Good evening and welcome to Medicine in Our Backyard. This is a series presented by the Newport Beach Public Library Foundation in partnership with UC Irvine Health. My name is Adrienne Windsor and I'm a board member of the foundation. I especially want to take a moment to thank our generous sponsors, Mike and Polly Smith. They have been with us since the initiation of this program, and I think we're heading almost into a decade where we have had the real advantage of learning from our amazing faculty and medical school faculty at UCI. Now, just to give you a heads up, this will conclude with a Q&A session, so we request you hold all questions until the end of the lecture. Use a Q&A box instead of the chat box. Now, you know, I always like to say a little bit about our foundation. We are a membership foundation and we would love you to join. This is our last one of the season, and if you have been benefiting from all of these presentations that we have brought to you, it's time to become a member. We have a special benefit too. On June 25th, we are having a summer solstice, a celebration of new membership. It's going to be a fabulous event with Dr. Connie Spinoza talking about her book, Chocolate Runs in My Veins. But the other part of it is it's preceded by a reception with food, with wine, with musical entertainment, with flamenco dancers, and it's all being held in our bamboo patio. So you have until May 31st, that's a week from today, to join. And if you join, you will receive an invitation. So become a member. I urge you to do that. Now, it's my real pleasure to introduce our speaker tonight, Dr. Lisa Gibbs. She's a professor in the Department of Family Medicine, UCI School of Medicine, and chief of the Division of Geriatrics and Gerontology. She is also director of medical education at the UCI School of Medicine program in geriatrics and the director of a senior health center. She earned her medical degree from Stanford University and completed her residency and fellowship at UCI Davis Medical Center. She's going to talk to us tonight about life after the pandemic, what we have learned about physical and mental health. Please join me in welcoming Dr. Lisa Gibbs.
Well, great. Thank you, Adrienne, and thank you for the opportunity to be here tonight. I understand I'm finishing out the series this year, so I know you've had a very successful series, and certainly Chocolate in My Veins sounds wonderful. All right, so tonight we'll talk about a little bit about recovering from the pandemic. And we'll mention, you know, the resilience that we all have as we come back. This is a quote that I think describes what I'll be speaking about tonight. It's from a French poet, and it means I bend but do not break. And to me, this reminds us of coming back from a challenge. And this is what this talk is about: learning how to be resilient and coming out on the other side from this pandemic. Even though it's not quite over, we hope that the worst is over. But I'd like to start with the concept of ageism, which was highlighted by the pandemic. And I will be going through, you know, some tips about mental and physical health. But before I do that, I always think it's appropriate to discuss ageism, no matter where I'm presenting, because it turns out to be always relevant. And the pandemic brought this out, I think, in stark colors this past year or 3 years, when we even started about having to ration healthcare. But if we look at our own healthcare systems, we realize that this is a part of our systems every day. The assumption that older people aren't resilient is implicitly ageist, and that's why I like the term resilience. The thought that perhaps our patients can't recover, or that pain is a part of life, or that we shouldn't look further because older people die, or that loneliness is common and therefore it's a part of aging, or that older people can't make their own decisions, even with dementia. is really, these are all examples of ageism. And this is, as a geriatrician and a group of geriatricians at UCI Health, we're advocates for older adults, and we fight ageism every day. And it turns out that as people age, they diverge more and more in terms of functionability and health. So it's really ironic that though geriatric medicine is based on age, we actually focus on function and syndromes that affect function. And there are some true implications of ageism. There are some studies, current studies out that show that 1 in 17 experience frequent healthcare discrimination. And when they do, it's associated with a new or worsened disability by 4 years. There is a huge financial cost to ageism, and this is now being studied by researchers based on modeling techniques of health economics. And they've determined that a 1-year cost of ageism was $63 billion, or 1 of every $7 spent on the 8 most common health conditions in the United States. The types of ageism that were examined not only include unfair treatment of older patients, but also those stemming from beliefs in society, negative stereotypes about older people that we pick up, or even negative views of older people themselves. And now they're able to study the fact that this all translates into the financial cost of ageism, and an ageism which we implicitly accept. So now that we've heard a little bit about ageism, I want to talk about the opposite. How do we become age-friendly, and how do we commit ourselves to this type of healthcare? And I'm happy to say that we've been working for a while at UCI in terms of becoming an age-friendly health system, which is a national designation. And it means that for every patient that comes through our doors, we have a commitment to the 4 M's. So the 4 M's are right here. One is mobility. The other is mentation, which covers delirium, depression, and dementia. Another is attention to medications and the safe use of medications. And finally, the most important, I think, is what matters to our patients, what matters to you in your healthcare. And so we are slowly, working one by one on these throughout our health system, making sure that everybody's aware of this and practices age-friendly healthcare. Okay. Now, to continue about recovery from the pandemic, and I think, again, we need to reset ourselves. And I bring up the concept of ageism because I think it's time to really understand what that is and demand what we need out of our healthcare. In terms of recovery from the pandemic, I'll cover mental health and physical health. In addition to the effects caused by the virus, what are the effects from living in a society that basically shut down for 2 years? What happened to quality of life? Now we know that it had really profound effects on our older adults in the community, especially in assisted living facilities and nursing homes. There was no perfect solution to this pandemic, but in hindsight, we realized that sometimes the prevention was probably worse than the disease. And not in every case, I think it's a person by person situation. But truly, we suffered in many ways, not just from the virus itself. We know that there were many mental health effects from the pandemic, and these are just a few. Isolation, of course, because we were basically shut off. We've had many patients living, for instance, in their communities, in their homes, in assisted living, who basically had to live in their rooms and have the food, shoved under the door for weeks at a time. And really people suffered not only developing more depression and anxiety and actually worsening dementia, but in loneliness. Okay. Caregiving. Sometimes, our caregivers were ill, or we couldn't trust that we could let caregivers into our home because they might bring the virus. And caregiving became a new a really different situation because the daycare centers closed down and all the senior centers closed down and all of the things that we used to enjoy closed down. And then a lot of people didn't get regular health care. And then, of course, there was a lot of bereavement. The age groups, over 65 and 75 suffer the most deaths from this virus. So we're still trying to come back and find our way back from understanding that some of our loved ones have passed away. Okay. I want to say a little bit about isolation and loneliness. They're not the same. One can be isolated without being lonely, and one can be lonely even in a group of people. But senior loneliness is now understood to be an epidemic in the United States. In fact, not only in the United States, in Britain, they created a position for the Minister of Loneliness that they considered it such a problem. So we do understand that this is a problem in our communities. And the risks for isolation continue to be living alone and difficulty speaking English, according to our studies. I'm going to move on to a map of older adults living alone in Orange County. There's a new report out. I have a reference a little bit later on, but I encourage everyone to take a look at it. But if you look at the areas where people are living alone, the darker green are those areas where there's more density of people living alone. And Newport Beach here is one of them, as well as Laguna Woods and this area here between Santa Ana, Irvine, and Costa Mesa. So just something to know about the community and the fact that people may need reaching out to. So back to ageism, depression in older adults is not normal. We don't consider it a part of aging. And if healthcare providers, or anyone makes us feel that way, then that's completely wrong. So we often find this threat of ageism in geriatrics in these conditions such as depression and memory loss. And unfortunately, these are things that we need to reverse. Okay. But we do see depression, loneliness does contribute to depression. We know that in older populations, major depression occurs in 1 to 5%, and significant depressive symptoms in 15%. And this tends to be worse as people require more care, more home health care, and even highest in nursing home patients. And we have to be careful about how we ask about depression, because sometimes, no matter what the age, people don't want to really admit that they may be depressed. So we sort of get around this, and we know that, so we ask in different ways. But depression and anxiety did get worse during the pandemic. I know you won't be surprised by this. In one study here from the Kaiser Foundation, it was found that 1 in 4 adults 65 and over reported anxiety or depression in August of 2020, a rate that has been fairly constant. And this rate is substantially higher than the 11% that Medicare reported in 2018. So an increase of 15% of depression and anxiety during the pandemic. Okay. The other thing that we need to keep in mind is that there is something called long COVID, which I'm sure most of you have heard about. Approximately a third of our people that survived COVID-19 do have some type of long-lasting effects. And I could spend an hour going through all of those, but in this particular case, I just wanted to point out that it could be even prolonged fatigue, or things that lead to depression. So we want to keep this in mind too as we recover from the pandemic and speak to our healthcare. All right, I'm whipping through this a little bit, but I have a lot to cover. This is never a topic that we like to talk about, but I feel like sometimes this has to be mentioned. Because there has been an increase in suicide rates since the pandemic as well. And just to give you an example, this is pre-pandemic, but it holds true that unfortunately suicide rates in older adults become much higher after the age of 65 and then after the age of 85, and men in particular. So in this particular graph, the blue bar represents all persons, the green bar represents males, and the orange females. And you can see that in this situation, all of these bars are higher than all ages. And as we look at older adults over 85, the blue bar gets almost, I would say, increases by a third. And these are Orange County rates, and these rates, though, are constant throughout the country. So again, we want to be aware, unfortunately, that these exist, so we can reach out and get people help if it's needed. And the things that you might look for in your community or other neighbors and friends, that suicide risk tends to be higher in older men than women. Among people that attempt, older adults are most likely to die. If there's a firearm available, it doubles the risk. It is higher in the first year after the loss of a spouse, or if people are facing profound physical illness, such as new dialysis or end-stage renal disease. And of course, substance use and abuse, alcohol and drugs worsen this risk. Okay, and I just show this here in case we do have a 24-hour prevention lifeline in Orange County, which can be found online. And this is the number in case anybody would like to jot it down. Okay, so really what has been shown to help us recover and bounce back, potentially if we've been isolated and lonely and fighting depression and anxiety, what's been shown to really help people come out and come back are engagement in community. Okay, so one study showed that fewer adults who belonged to a local community felt lonely, 26% compared to the 39% who were not engaged in their community. So it's, we can prescribe medicines and therapy, which are sometimes helpful, but just being active in your community and meeting and having purpose with other people is just absolutely huge. Volunteer work. So another study showed that approximately 11% of adults 65 and over do engage in volunteer work in Orange County. And the volunteers who had volunteered in the last year were substantially less lonely than the people who had not volunteered. So these are two things that, our society needs so many volunteers and so much help, and the wisdom and experience of older adults are absolutely necessary. And I'm referencing the Orange County Strategic Plan for Aging, Report on Aging, which just came out and has a lot of fascinating information about Orange County resources and really what we're doing to prepare our county for an aging society in the next 20, 30 years. Okay, so again, resilience, having purpose, and social connectedness are really the triad that will help us recover our mental health as we come out of the pandemic. Okay. Now I'm going to move on to talk about physical health. Okay, as many of you know, well, many of you may have experienced not being as active during the pandemic. So when we were told to stay home, we also, stopped walking, we stopped moving about, we stopped becoming physically active. There's the saying the COVID-15 now, and many of our patients are coming into the office, with 15 more or so pounds than they had before the pandemic, with just that just sort of sad comment that they stopped exercising and they're trying to get back to it. And so we firmly believe that exercise is really one of the best medicines. And so that's why I wanted to devote the rest of this talk to becoming and being physically active. Okay. So we have all manner of activity. On the left, you may have heard about this retired bank clerk who became the world champion pole vaulter and heptathlete at the age of 77. And then we have others who are physically fit and running races. Many of us are sitting all day looking at our computer screens. Certainly a risk for myself as well as everyone else. And I also show pictures of people walking with a walker and in a wheelchair because there are exercises and ways to become physically fit and conditioned no matter what our status is. So if we're using a walker, there are exercises that we can do. Same thing with wheelchairs. At least sometimes we can have our upper body strength. Very, very important. So no matter what function people have, there's always more activity and more exercise that can be had. I want to take us back a little bit to the physiology, which helps us understand the benefits of exercise. So we know that muscle mass peaks around the age of 25 to 30. And after this, unfortunately, adults lose up to 8% of our muscle mass per decade. Okay, so if there's any 30-year-olds here in the audience, this is your time. Okay. The good news, and I'm going to talk about this as we can get some of this back. The bad news is that, if people lose enough muscle mass, we call it sarcopenia. And unfortunately, in our society, 20% of community dwelling adults below the age of 70 and more than 50% of those over 70 can be characterized as having sarcopenia, which is just more than just a normal loss of muscle mass. Okay. The other major change that happens is cardiac output. Cardiac output also decreases after the third decade at about 1% per year. And the good news is, though, we find that in people that are physically fit and have, endurance exercise regularly, that they can actually improve their cardiac output as well. Okay. Now, on the flip side, the effects of sedentary activity are real. You may hear about the 10,000 steps a day and being sedentary, like every 30 minutes you're sedentary, cuts off a minute of life. It can be stated so many different ways. But what we do know is that adults age 60 and over spend more time engaged in sedentary behaviors than any other segment of the population. And in this particular study, they looked at, a lot of us that are spending 8 to 9 hours a day sitting, or 60% of waking time sitting and not being physically active. Okay. Sedentary time is associated with functional limitation. And it says even in those that achieve the recommended amount of moderate to vigorous physical activity. What does this mean? This means that even if you do your due diligence and you have your 30 minutes a day of moderate to vigorous physical activity, it's still detrimental to spend the rest of the day sitting. So we need both. We need a lot of activity during the day, and we also need the recommended amount of exercise. And again, that's really depending on what level you are, at least keeping yourself moving. So, and why? Does physical status really relate to better function? And the answer is yes. These are major population studies that are really hard to conduct, but from the ones that we know and the best ones, one here I have showing a randomized trial that enrolled participants for an average of 2.5 years. And those that did participate in a moderate intensity physical activity program had reduced disability over 2.5 years. So yes, it's very important to retain function. And of course, as we know, it's better to prevent the loss rather than reverse the loss. There are so many reasons, again, to really pay attention to this. We know that physical fitness reduces cardiovascular disease, stroke risk, hypertension, diabetes, osteoporosis, obesity. There's some amazing studies coming out about how physical exercise prevents certain types of cancer and even reduces the mortality of people who are being treated for cancer. Exercise ameliorates the risk for depression, and we also have some studies coming out showing the reduced risk of dementia. So if I haven't given you enough reason to exercise, I don't know what else to do, because it's pretty compelling. There's another major study, randomized control study with 3,000 people, and they divided the people into different arms. One focused on their lifestyle, so exercise and diet, and one group was given metformin, which we do use in diabetes. And after a 15-year follow-up, there was a 50% lower progression to diabetes in the lifestyle group than in the group with the metformin. So again, just another indication where you find that exercise is even more powerful than the medicines that we have. We talk a little bit about dementia and some of those studies. We have so far 11 studies showing an inverse association between physical activity and the risk for dementia. And two of the most well-known are the Nurses' Health Study and the Mayo Clinic Study on Aging and the Framingham Study. And again, they both show the same trend, that participants reporting moderate to heavy physical activity for their lives or some period in their lives had halved the risk of dementia. So again, pretty compelling. Okay. And there are so many reasons why we think this is true, and this is the subject of research. And I don't show this slide to go through all of these mechanisms, but just to point out that they're being studied, and people are just more and more convinced that the reasons that we have, that there are more and more reasons that exercise does help us. Okay. And I want to move on to another concept called frailty. Because I bring these up because there's a lot more people that now are frail, having gone through 3 years of a pandemic, and we need to do whatever we can to reverse that. And the good news is we can. But frailty is just one step beyond deconditioning. Frailty is when people become so deconditioned that it really starts to affect their function. You know, they're no longer really able to do the things that they used to do, and they truly are weaker. And, you know, they may be losing a lot more muscle mass and so forth, and just not able to keep up their daily activities. This is a really big interest to geriatricians because we know that frailty increases the risk to a lot of other problems, including frequent falls, fractures, delirium, cognitive impairment, even incontinence. And we know that we find this in up to 16% of our community. And we know that a pre-frailty prevalence is almost up to 44%. So again, very, very common in our communities. And why do I care about this so much? Because like I said, it's found to be associated with all these adverse outcomes. This slide shows actually outcomes of frailty after surgery, right? So it's associated with a lot of these adverse outcomes after surgery. And in 23 articles reviewed, the strongest evidence lies in increased 30-day, 90-day, and 1-year mortality, the more frail someone is. Okay, and it's also associated with the things that are listed here: hip fractures, disability, longer hospitalizations and readmissions, and again, adverse outcomes. Now, the good news is, it's always the good news, bad news, but here's good news, that we do have some more studies showing that we can reverse this. this slide actually still lists out some of the postoperative complications. And this slide actually shows us that if you look here at this column, if someone had a low risk for frailty, they were had an 80% chance of going home after hip surgery. Whereas if there was a high risk of frailty, there was only a 6% chance of actually going home and living independently. So very, very important to be as fit as possible. Okay. Now, again, I say frailty is reversible. So we know this. And, you know, the whole reason for going through this is to really empower all of you to really get active and understand where your physical conditioning is. Okay, I'm going to mention one trial here. It's called the FIT trial, which proved to us that we can reverse frailty, but it has to be consistent. So basically in this study, we showed gains in physical strength, mobility, and function, and a 15% decrease at 12 months. Now, they didn't see this effect at 3 months. They saw it at 12 months, which shows that it really has to be a lifestyle. And I think that's one of the hardest things to understand about being fit. I mean, it's a discipline. It's just something that has to be built in to what we do every day. Okay. So again, advocating age-friendly exercise, we want to do it safely. So we know in older ages too, it's a little easier to maybe injure oneself in exercise. So if you're just starting out, start slow. Try to avoid injury, take it easy. Consider physical therapy or asking your healthcare provider for physical therapy if you have one or two particularly problem joint areas or pains and you'd like to get specific exercises for that. Consider an exercise prescription. So we also work with sports medicine physicians. At some point, I'd love to have a sports medicine clinic within our geriatric clinic, but we're not there yet. But we should ask for exercise prescriptions as we go forth. Join support groups for weight loss. There's a lot of remote monitoring now. A lot of you had Fitbits and Apple Watches. And just monitoring even walking steps helps tremendously. And again, there's disability-friendly exercises for those in wheelchairs or those who don't feel like they have a balance to be safe. Okay, all right. And the CDC, the Center for Disease Control, when they're not trying to fight COVID, they do come out with different recommendations. This is one for exercise in older adults, 65 and over. And they recommend at least 150 minutes a week of moderate activity, such as brisk walking, at least 2 days of strengthening, because again, by strengthening, we can get some of that muscle mass back, and activities also to improve balance, okay? And if you know, there's also recommendations for adults with chronic conditions. Same type of recommendations, but just tailored toward people with different functional levels. Okay, so I will conclude there, but again, just to remind people, you know, we need to just consider that we've been under extreme stress, strain, especially our older adult populations who have suffered the most out of everyone. If it not only because of COVID-19 itself, but because of the loneliness, the isolation, the lack of healthcare, the lack of society. And we realize this in our practice. So we understand that recovery includes physical, emotional, spiritual, and community work as we come back and we learn how to be resilient. So I'm gonna finish there. I'll just leave you with Hippocrates, one of Hippocrates' sayings. Again, walking is man's best medicine. Not just a flippant saying, but it turns out there's a lot of science behind it. And it really says a lot. It's one of my favorite quotes. So I'll stop there. I'll just leave the slide on. We do have UCI Health Geriatrics, Facebook and Instagram if you like to do social media. And we also have a new UCI Health Laguna Hills clinic for geriatrics, and as well as in Orange, if you're looking for a geriatrician. So, all right. So Adrienne, I'll turn it back over to you, and thank you very much.
Okay, thank you, Dr. Gibbs. Kunga, is my video on? Well, nevertheless, that was, so helpful, I think, for all of us, because this has been a very, very stressful time, and we need advice. So let's see what kind of questions we have here from our audience. I'm looking. Kunga, can you send me the Q&A? I have a question. While I'm getting this, how do you encourage people who've just stopped attempting to do anything? What do you say to them to get them to move, to get up and go?
Well, first of all, everyone's an individual, so we may look at their health conditions and what they're working with, whether it's hypertension or diabetes, or even if there's really no major health condition, and just, let people know how important it is and what the risks are if we don't start exercising and we continue to be sedentary. And some people, are not interested, because it is a change in behavior. But we know that it's the best advice we can give, so we have to continue giving it. But I find that most of my patients really do want to. They want to get back out there. They might just, not have the motivation right away. But eventually people really do start to move more, and then we check in with them as well. And that seems to work pretty well.
And I'm sure as soon as they start to move and start to do some of these things, they have a better sense of well-being.
Mm-hmm.
Make a big difference too. Here's a question from a woman who is 67 and lives alone. She got COVID in August of 2021, and she feels that her cognition has been significantly impacted by either the isolation, almost 2 years, or the virus. She's hoping somehow it improves coming out of the pandemic, but so far she's not encouraged. Wants to know if there's anything I can do besides play Wordle and Quordle every day and exercise. Kind of a joke, but at least.
Yeah. I think the brain is resilient as well. So I think those puzzles are great, but again, there's nothing like just even starting to walk. Even if you walk around the block, I didn't talk about this, but part of keeping the brain healthy is keeping the blood and all the nutrients and the oxygen circulating to all of our body, including the brain and the heart and the kidneys and everywhere else. But you can't go wrong, by getting up and walking, because you're only going to help your brain recover by giving it the oxygen that it needs. So, and then I do think, working the puzzles is great. There's a lot to be said for just socialization. And that seems to help a lot when people become isolated. It's just good to get out, even if it's on Zoom, maybe a support group on Zoom, or just calling up friends, but just be as social as possible, interact, speak, use your language, use all the parts of your brain, and then just start walking.
Okay, and it will respond. We have a question here about the difference between isolation and depression.
Well, okay, that's a great question. So we know that isolation is a risk for depression, but depression is really when people's mood is down. We ask people, for, you know, how many days of the week have you awakened and just had no interest in doing anything, for instance? You know, I mean, depression gets to a level where you're just really not motivated. People might sleep too much. They might not sleep enough. People may eat too much. They may not eat. You know, everybody can be a little bit different. But I think when people start to like not be as interested in talking to their friends or their family as they were before, and they're not interested in doing the activities they did before, then that's a real wake-up call that somebody may be suffering from depression. Yeah. And that's time to get help. You know, and again, that engagement is so important. And then having purpose in our lives, like volunteering is so important, but it's also very important to reach out to your healthcare provider and let them know what's going on, because we have many ways we can help.
Thank you. We have a question here about the laws in California regarding the right to die. I suppose this is something that comes up for people over 85 frequently, if they are isolated and depressed. And
so there, you know, I kind of caught me off guard here, but I'll answer the best I can. So there is physician-assisted suicide or end of life, and there are certain doctors that are trained in doing that, and so that, you know, that is an option for people, I think, who have a certain set of criteria. And one of those criteria would be that people are not depressed. I think that if people have a treatable condition like depression, that would be addressed before somebody would get to that point of, you know, being, so to speak, eligible for physician-assisted ending of life.
And there are medications for depression that a healthcare provider could give to someone who's suffering from this?
Yes, a lot of people don't realize that we have what I would consider very successful medications. People that I see are very afraid of being addicted to medications, especially those that treat mental health. And, you know, I think many, many years ago, some of those medications were addictive and caused problems. But the medicines that we tend to use, and especially the ones we use in older adults, you know, they are not addictive. We can use them very safely. And oftentimes we have many we can choose from. So if the first one doesn't work, or if someone doesn't feel like they have an effects from it or don't like the side effects, there are other things that we can do. So I think my hardest job sometimes is just really letting people know that we do have good medicines and they're not addictive and they can be very safely used. And, you know, we don't see mental health problems or depression as a stigma. We see it as another medical condition, frankly. We have drugs to treat hypertension. We have medications to treat depression. And someone may need it for a number of months and maybe not lifelong, you know, and some people do need it lifelong. So it just depends, but there's a lot of reasons to get help.
So we should feel confident and fine about asking for help if we feel like we need it, and not be ashamed or embarrassed. I think we've made great strides when some of our Olympian athletes have helped us with this issue of mental health, and the fact that it doesn't matter how old you are susceptible to it. It can happen.
Yeah, absolutely. It can happen to anyone. I have some patients I've seen who have been anxious all their lives. And, you know, they get to the point where they're willing to try some of these treatments and they come back and they're just grateful. They say, I had no idea that I could feel this way, this good again. So yes, and also it's now become really a standard of care for us to ask. So when you're in our offices, don't be surprised, you know, at some point during the year, we're going to ask. And so it's just doesn't have the stigma it used to.
Thank you. What are your thoughts on Tai Chi as a means of movement, specifically for avoiding the risk of fall?
Mm-hmm. Oh, we think Tai Chi is wonderful, balance and strength. So yes, absolutely. I think it probably shouldn't be the only thing that one does because it's not an aerobic type of exercise. So you'll have your balance and your strength, but then I would also add on to it some brisk walking as well to make sure you're getting the aerobic part.
But is it true that even if you can't walk briskly, just walking?
Yes, yes, it is true. It's so more is better, but getting out and just walking even a slow pace, even a short distance is absolutely beneficial.
Thank you.
Mhm.
We have a questioner here who has diabetes and wants to know if it's safe to go back to the gym for classes where there are no doors open if she wears a mask. Is the mask necessary? Where are we with masks?
Oh, so we are unfortunately encountering a lot of community transmission now. In fact, there was just an article that said that California cases are up 60%. So to me now is not the time to stop wearing a mask. I would, in this case with diabetes, at this time, I would still be very careful. I would wear a mask and I would probably try to exercise outdoors until the community transmission drops again, which we think it will do over the summer. Then we think possibly we might see a fall surge. So we just have to keep watching the news.
All right, thank you. We have a question here about, are there other mental health disorders that affect the aging population more than people who are younger? I mean, other than anxiety and depression.
That's a good question. Typically other mental health disorders like schizophrenia or bipolar disease will become apparent in younger years. Although we do see people who do, who certainly do have schizophrenia or they've lived with it throughout their lives and they're just living with it now, getting older. It's a little more rare to have these things come up after the age of 65. Although sometimes we find people can develop what we call psychosis or beliefs or fixed beliefs that don't help, like maybe being afraid that a neighbor is targeting them or something without real evidence. So there are some cases like that. There are some cases of just having hallucinations from medical conditions, such as dementia. But certainly if people have, any of these, we would recommend just a basic medical workup first, because I'm not going to assume that, someone has a memory problem or someone has, X, Y, or Z. We would just have to see someone to really evaluate that. So the short answer is yes. Although to have something really serious diagnosed after 65, aside from depression, anxiety, is more rare.
I see. All right. So how would you differentiate between the various kinds of fitness programs, yoga, Tai Chi, exercise classes? Which are the preferable programs?
Well, if I follow the, the CDC recommendations, which I think are good, a good exercise program would involve the aerobic exercise, but it would also include strength training and balance. So if you have a favorite way of exercising, that's great, but then I would just augment it to make sure that you're getting all of that every week. So again, the CDC said, well, let's try for 150 minutes of aerobic, which is basically 30 minutes, 5 days a week. But in addition, we want you to do some type of strengthening exercise twice a week, and we want you to do some type of balance. So if you love yoga, that's great. That's great for balance and strength. But then also do something, again, that gives you that aerobic workout for your heart.
Thank you. Here's someone who has been doing Zoom during COVID, but feels unconnected and is wondering how Zoom compares with live interaction.
Well, I think that might depend on older adults, but I think, you know, it's not the same. It's better to get out there and meet people and actually have real social interactions. I think Zoom became popular through the pandemic, and thank goodness we had Zoom, because it allowed us to continue with meeting people we knew. And it's helpful there, but it's not the same. It's not the same as getting out of your house or wherever you are, and actually meeting real people.
So we need both and, or
yeah, I mean, Zoom is great. It kept a lot of us safe.
it did.
As we continued working and we continued, you know, wanting to see our family and friends. I mean, there's definitely a role for it. And it kept us in touch with our healthcare, you know. I mean, thank goodness we had Zoom. But when we have the opportunity, we definitely need to get out into the real world again.
Good. This would be good for me too. Any suggestions for aerobics if you have joint issues?
Yeah, that's where the exercise prescription comes in, because you're right. You certainly don't want to stress your joints to the point where they get worse. But then again, we realize, like with knee arthritis, we realize that by strengthening our quadriceps, we actually help our arthritis because it provides stability for the joint. So you could start with certainly getting some exercises from physical therapy. But I would say certainly walking, stationary bicycling will strengthen those muscles. And certainly, you know, your physician's office should have some ideas as well. But if you're really struggling with painful joints, I would probably start with physical therapy first and then move on from there.
Okay, thank you. This will be the last question. This is to ask you if you would give a list of services available through UCI. I think you probably have that for us.
A list of services available with regards to
to all the things we've talked about here.
Oh, I think we can get that for you for sure. And I can follow up with you. Would I send it potentially through you, Adrienne?
You could, yes. I know this person. I will pass it on to her. Her
Okay.
name is Burns, and I'd be happy to do that. Other people who might want this list could just send it to our foundation website, and we'll see if we can find a way to transmit that information.
Okay, that sounds great. Yeah.
Thank you so much, Dr. Gibbs. This has been very, very helpful. We had many people in attendance tonight, and we appreciate your help. This is the last of our Medicine in Our Backyard series for this year. We will be back in person at the Newport Beach Public Library in September of 2022 with a whole set of exciting topics and doctors. We do have our YouTube channel on the website, so if you missed any of our talks, tune in and you may watch them now. Once again, I urge you to join and become a member of the foundation before the 31st and come to our great party. And if you do, I want you to come up and say hello, and I'd be happy to meet you. And I also want to thank Kunga and Jane Merritt. These are the people who make these programs possible. Jane works with UCI, and Kunga works with us here at the foundation. She's our program director, and they've done just a fabulous job of coordinating for us throughout the year. So go forward, everybody, be healthy, get out there and exercise.
Right.
Okay, great. So thank you so much.
All right. Thank you so much for the opportunity. Bye-bye.